Hello and welcome. Around 30% of women in India are living with urinary incontinence (UI), where most of cases are unreported. The prevalence of UI increases with age. It comes with an embarrassment, frustration, anxiety, depression, and fear of odor, which ultimately affects the quality of life of those suffering from it. On this day, World Continence Week, celebrated by International Continence Society (ICS), an initiative has been taken to spread awareness about incontinence-related issues. So today we'll be talking about urinary incontinence and its impact on an individual's life. तो अब हमारे बीच डॉक्टर चंद्रकांत पंचोली है. He is a consulting urologist practicing in Mumbai, suburban regions at Galaxy Hospital, Vardhan Hospital, as well as in Amneet Hospital. So very, very warm welcome to you, doctor.
Hello, good afternoon. Thank you for inviting me for this chat show for the International Incontinence Week. I would will be very happy to share my views regarding the same. And I would be very happy to inform my patients and general audience about overactive bladder, its related symptoms, and little bit more about incontinence, what we all should know.
So what is urinary incontinence?
Urinary incontinence is nothing but uncontrolled leakage. When you cannot control your leakage problems, it is called as urinary incontinence. Urinary incontinence can be of various types. Depending upon the cause, we divide them into 5 major causes. Urinary incontinence may be stress related. I would like to explain you everything in detail. Stress urinary incontinence is like when your bladder is full, when your urinary bladder is full, and you get sudden stress in the form of coughing, sneezing, etc. Then there is a leakage of the urine, and your sphincter cannot hold the urine. I would like to just show you some of the anatomical models for the details. Suppose this is the male urinary part. You have a bladder, you have a prostate, and you have a control mechanism at the bladder neck and at the region of the prostate. We have the internal sphincter and the external sphincter. These two sphincters usually control our urinary leakage. Now, when patient gets sudden stress is when your bladder is full and suddenly the bladder gets compressed with the abdominal muscle. It is called as stress urinary incontinence. So stress urinary incontinence is that when you get sudden stress in terms of coughing or straining, it is called as stress urinary incontinence. Second is urge urinary incontinence. Urge urinary incontinence is like when bladder is not completely full or bladder is partially full. Depending upon the capacity of the bladder, you get the urge to pass the urine, but you cannot control that urge and you start leaking. Then it is called as urge urinary incontinence. Third variety is mixed urinary incontinence. It is a mixture of both stress urinary incontinence and urge urinary incontinence. It is called as mixed urinary incontinence. Stress urinary incontinence we usually see in the post-menopausal women who have given multiple childbirths. उनमें हमें स्ट्रेस यूरिनरी इंकंटिनेंस दिखता है बिकॉज ऑफ द पेल्विक फ्लोर मसल्स जो रहते हैं वो मल्टीपल चाइल्ड बर्थ की वजह से वीक हो जाते हैं, स्पेशली इन द पोस्ट मेनोपॉजल वुमन. सो वी सी स्ट्रेस यूरिनरी इंकंटिनेंस. अर्ज यूरिनरी इंकंटिनेंस वी यूजुअली सी इन द केसेस ऑफ बिनाइन प्रोस्टेटिक एनलार्जमेंट. मेल्स में ज्यादा दिखता है. इट मे इवन बी सीन इन फीमेल्स ऑल्सो, बट प्रोस्टेट रिलेटेड इश्यूज जो मेल में रहते हैं उसमें मेल में अर्ज यूरिनरी इंकंटिनेंस दिख सकता है. थर्ड इज मिक्स्ड यूरिनरी इंकंटिनेंस. Fourth is overflow incontinence. Overflow incontinence when your bladder is overflowing, your sphincter is not relaxing, but because of the overflow, there is a leakage of urine happening. So just like your bucket of water overflows, bucket of water जब भी पूरा भर जाता है, when it overflows and the water spills on the ground, the same way the overflow incontinence work. It is just like a overflow of the urine from the bladder. There is no continence, there is no closure mechanisms working, there are no sphincters working. It is called as overflow incontinence. Overflow incontinence हमें usually neurological causes में spine damage हुआ है, spine का कोई surgery हुआ है, उसमें मिलता है. And last is total incontinence. Total incontinence is like there is nothing overflow. जो आपका जो sphincter mechanism है वो zero काम कर रहा है. जैसे ही यूरिन अंदर ब्लैडर में आ रहा है वैसे ही उसका लीकेज स्टार्ट हो रहा है. There is no storage of urine. That is called as total urinary incontinence. Total urinary incontinence usually हमें again neurological causes में मिलता है, जहाँ पे sphincter का function zero रहता है and even bladder is not able to store the urine. It is total urinary incontinence.
So why do you think UI happens?
There are urinary incontinence. Aging process is the most common. Aging process, aging related जो रहता है which we call as overactive bladder. Urinary infection के कारण हमें incontinence मिल सकता है. पोस्ट आपका कोई सर्जरी हुआ है, ब्लैडर का सर्जरी हुआ है, प्रोस्टेट का सर्जरी हुआ है, then we get post surgery urinary incontinence मिल सकता है. आपका कॉन्स्टिपेशन की वजह से आपका यूरिन ब्लॉकेज हुआ है, या फिर बिकॉज ऑफ कॉन्स्टिपेशन there is urinary retention, you may get overflow incontinence. ओवरएक्टिव ब्लैडर में जैसे मैंने बताया कि ओवरएक्टिव ब्लैडर में हमें अर्जेंसी इनकंटिनेंस मिल सकता है. स्ट्रेस यूरिनरी इनकंटिनेंस मैंने पहले ही बताया कि मल्टीपल चाइल्ड बर्थ हुआ है. इफ यू हैव हिस्ट्री ऑफ मल्टीपल चाइल्ड बर्थ एंड वीक pelvic floor, आपका pelvic floor muscle, especially in females, postmenopausal females, when the pelvic floor is weak, आपका then you get the stress urinary incontinence. Then other factors are like smoking, alcohol. When you have the pregnancy, even pregnancy में भी urinary incontinence मिल सकता है. Then there are multiple causes, neurological causes, जैसे मैंने बताया spine का issue है, या फिर कोई there is compression of the nerves. Then we get the urinary incontinence. brain stroke है, cerebrovascular accidents है, उसमें भी हमें urinary incontinence. When the central control of the bladder is gone, we get the urinary incontinence problem. All this causes the type of urinary incontinence which we get is different. जैसे मैंने बताया कि स्ट्रेस यूरिनरी इंकंटिनेंस पोस्ट मेनोपॉजल वुमन में जिनमें मल्टीपल चाइल्ड बर्थ हुआ है उसमें होता है, और ये यूरिनरी इंकंटिनेंस यूजुअली इन्फेक्शन में होता है, बिनाइन प्रोस्टेटिक एनलार्जमेंट में मिलता है, ओवर एक्टिव ब्लैडर में मिलता है. मतलब द टाइप ऑफ द यूरिनरी इंकंटिनेंस व्हिच वी गेट इज डिफरेंट इन ईच कॉज. These are the blanket causes. जो भी मैंने अभी causes बताया वो blanket causes है, बट ये causes में कौन से टाइप का urinary incontinence हमें मिलेगा, तो that is more important, because if we don't recognize the type of the urinary incontinence, then we cannot treat it. The treatment depends upon the type of the urinary incontinence. Treatment हर एक का अलग रहता है. जैसे stress urinary incontinence है तो उसमें pelvic floor का strengthening muscle का exercise रहता है. Then we have the certain taping जो नीचे से यूरेथ्रा को सपोर्ट करता है. तो स्ट्रेस यूरिनरी इंकंटिनेंस का जो मैकेनिज्म रहते हैं वो अलग रहते हैं, और यूरिनरी इंकंटिनेंस के मैकेनिज्म्स अलग रहते हैं. मिक्स यूरिनरी इंकंटिनेंस के मैकेनिज्म्स और ट्रीटमेंट अलग रहते हैं. ओवरफ्लो में हमें ट्रीटमेंट अलग करना पड़ता है. तो एवरी टाइप ऑफ द यूरिनरी इंकंटिनेंस हैज डिफरेंट ट्रीटमेंट मोडालिटी. तो हर एक इंकंटिनेंस जो भी हम टाइप है उसको डिस्टिंग्विश करके पेशेंट को कौन सा टाइप का यूरिनरी इंकंटिनेंस है वो हिसाब से उसका ट्रीटमेंट डिसाइड.
So this is a very familiar term, OAB in medical field, overactive bladder. How is UI related to overactive bladder?
See, overactive bladder by definition is urinary frequency nocturia with or without urinary incontinence. जो overactive bladder में the incontinence which we get is usually urgency incontinence. The type of the urinary incontinence which we get in overactive bladder is urgency incontinence. Patient cannot control the urge to pass the urination. Overactive bladder by definition is without any pathological cause. By definition overactive bladder में सभी pathological cause rule out हो चुके होते हैं. बाय डेफिनेशन हर एक अगर आपके पूरे फुल फिजिकल एग्जामिनेशन एंड रेडियोलॉजिकल इन्वेस्टिगेशन में all the other causes of urinary incontinence and all the other causes of urinary incontinence as ruled out, then and then only we label that as a overactive bladder. It is not like that if the patient is having infection, urinary tract infection, we cannot label it as overactive bladder. अगर patient को benign prostatic enlargement related urgency incontinence है, तो we cannot label it as overactive bladder. Overactive bladder, by definition, when we rule out every other possible causes of the urinary incontinence, frequency, urgency, urge incontinence and nocturia, when these irritative bladder symptoms are present without any pathological demonstrable cause, then we label it as overactive bladder.
So doctor, is this a very common occurrence? How many people in India do you think suffer from incontinence due to OAB?
Yes, I can understand. India mein there is a very poor data collection. Many cases are underreported. So anywhere between 10 to 30%. The range is very large. So anywhere between 10 to 30% is the range that what we get in the standard books. But again, the data is very poor. The cases are underreported. There is no standardization in collecting the data. So which usually we don't see the exact nature of the disease कि कितना prevalent है. Males and females as the age, usually females में ज़्यादा मिलता है, but as the age advances, we see the equal number of males and females. But in general, females में overactive bladder के symptoms which we see are far more than males. But as the age advances, even males may be overactive bladder के symptoms we see.
So is it really related to age or demography of incontinence due to OAB in India?
Yes, definitely. As the age advances, the urinary incontinence, जो overactive bladder है, overactive bladder related symptoms है, वो with the age increase होते हैं. The overactive bladder के again symptoms are waxing and waning course रहता है. The symptoms of overactive bladder have waxing and waning course. You may have the symptoms for 6 months, 1 year, 2 years time duration, and there will be a gap of relaxation for say 6 months, 1 year. Again, you have the higher symptoms. Again, you have the relaxation period. So waxing and waning course रह सकता है. It many a times food habits से भी food habits है, precipitating factors है, which again affects your overactive bladder symptoms. फूड हैबिट्स में मैं जैसे बताऊंगा कि कॉन्स्टिपेशन इज द मेजर कंट्रीब्यूटर फॉर द ओवर एक्टिव ब्लैडर. अगर कॉन्स्टिपेशन है, डेफिनेटली द सिम्टम्स ऑफ ओवर एक्टिव ब्लैडर विल इंक्रीज. स्पाइसी फूड है, स्मोकिंग है, अल्कोहल है, कैफीन इनटेक है, ऑल दिस प्रॉब्लम्स, ऑल दिस फूड हैबिट्स विल इंक्रीज द सिम्टम्स ऑफ ओवर एक्टिव ब्लैडर. यूरिनरी ट्रैक, पोस्ट यूरिनरी ट्रैक इन्फेक्शन है. That's again, even after the treatment of the urinary tract infection, you may have persistent overactive bladder symptoms. So there are multiple causes for it. Aging is the most probable cause. Certain food habits which we discussed, bladder irritants we have discussed, caffeine and alcohol and smoking, bladder irritants जो रहते हैं, which may be contributory to the overactive bladder, and constipation. These are the major contributor to the overactive bladder.
So doctor, this doesn't really sound so good. How does it affect the quality of the life of the person who is suffering from it?
Definitely quality of life is affected. It's like when you cannot control the urge, there will be some leakage of the urine. Patient will constantly feel the pressure to find out the washroom. We are the socialized person, so we cannot just like the lower animals, we cannot void anywhere we want. We need to get to the washroom. अगर washroom नजदीक में available नहीं है, I see patients who are getting stressed. They cannot travel नहीं कर पाते, लंबी दूरी तक travel नहीं कर पाते हैं, उनको बार-बार washroom ढूंढना पड़ता है. Even washroom नहीं मिला, when there is a leakage, they feel के socially embarrassment होता है, order related issues रहते हैं. The home, they also feel depressed, ओवरऑल क्वालिटी ऑफ लाइफ अफेक्ट होता है, पर्सनल जो सेल्फ कॉन्फिडेंस है वो अफेक्ट होता है, बिकॉज अल्टीमेटली एबिलिटी टू वॉइड नॉर्मली इज अ social skill. Ability to void normally is a social skill. So once you cannot void in a socially respectful manner, then definitely that is going to give you stress, and it will ultimately affect your quality of
So
life.
how do we avoid this? What are the possible management options available for this?
Yes, for the management of the urinary incontinence, we have the three layered structure. First of all, we advise patients lifestyle modifications. Then we give the medical management. And if lifestyle modifications, medical management don't work, then we suggest patient surgical management. Lifestyle modifications we usually teach patients behavior therapy. We teach patients pelvic muscle strengthening exercises. We ask the patient to have timely void. We explain the patient what is the importance for timely void, not to unnecessarily delay the maturation, to void every 3 hours. Double voiding करने बोलते हैं हम, कि even after going to loo, we ask them to go to loo again at the same time to reduce the amount of the post void residue. Double voiding, time voiding, behavior therapy, pelvic stress, pelvic muscle strengthening exercises, avoiding fluid at the night time, avoiding bladder irritants. जो bladder irritants है, smoking है, alcohol है, caffeine है, bladder irritant avoid करना है, constipation avoid करना है. Then these are lifestyle modifications. If lifestyle modification से भी it is not working, then we advise them the medical management. Medical management में we have the two major classes of drugs: anticholinergic drugs and beta-3 agonist, adrenergic agonist drugs. जो एंटीकोलिनर्जिक ड्रग्स है, ऑक्सीब्यूटेनिन है, सोलिफेनासिन है, टेरिफेनासिन है, ट्रोस्पियम है, ये सब एंटीकोलिनर्जिक ड्रग्स है. वो ब्लैडर को ओवरऑल रिलैक्स करते हैं, ब्लैडर का इरिटेशन कम करते हैं. The second class of drug which is recently launched 5 years back, it is mirabegron. It is a beta-3 adrenergic agonist drug which is again working in the same manner. The mechanism of action is different, but ultimate outcome is bladder relaxation. So these two are major class of the drugs. We give them in a titrated manner, slowly dose बढ़ाते हैं. We give combination of both these two drugs, mirabegron और solifenacin का combination देके देखते हैं. And along with the lifestyle modification and this medical management, we also give in male patients BPH related treatment है. Male patients है, उनमें अल्फा एड्रीनर्जिक जो हमारे ब्लैडर रिलैक्सिंग ड्रग्स रहते हैं, जो हम बिनाइन प्रोस्टेटिक एनलार्जमेंट में देते हैं, तो which we give bladder relaxant drugs so that the BPH related जो overactive bladder symptoms है, which we can control. So all these are comes under the medical management of the OAB. Surgical management of OAB again depends upon the severity of the overactive bladder symptoms. If the patient has very severe overactive bladder symptoms, we have intravesical botulinum injections therapy available, in which we give the anticholinergic drug, botulinum injection into the bladder में inside injection देते हैं, which controls the overactivity of the bladder. The effects are temporary, short lasting रहते हैं. Repeat injection बार बार देने की जरूरत पड़ सकती है. Over the period of time, once the patient has received multiple injections, then again there are chances that patient may develop bladder fibrosis, infection, fever, bleeding through urine. There are multiple side effects of this surgery. अगर intravesical botulinum injection से भी if you are not getting desired response, then we have neuromodulation techniques. Currently, major ऐसे neuromodulation techniques are not available in India. They are only available in Western countries. So that is the last modality of the treatment. But as long as Indian scenario is concerned, India में most of the urinary incontinence symptoms or urinary incontinence related problems are underreported or ignored. Most of the elderly patients, they wear the diaper and they just carry on. Family people also don't bother to treat the symptoms regarding the overactive bladder. They just wear the diaper, they just put the catheter and they move on in the life. It is very much underreported and ignored in India. The proper education or proper awareness is lacking. So we don't see that much cases of overactive bladder. But over the period of time, slowly and slowly, we are getting people educated. We are getting people aware that treatment is available for overactive bladder. And depending upon the cause, जो आपका cause factor है, if we can find out the cause factor for the your symptoms, then definitely we can help you in treating the symptoms.
So this is such a relief to hear that we have so many treatments available thanks to medicine and our doctors. But when do you think is the right time to seek for medical management or expert help?
When your symptoms are bothersome, अगर आपके symptoms are bothersome, then definitely you should need a help. जैसे मैंने बताया, initial lifestyle modification से definitely जो specialist consultant है, you need to consult the specialist consultant to rule out the other cause. The specialist consultant आपको they will do the physical examination. Physical examination में we check whether the bladder is full or not, whether the external genitalia are normal, whether the patient को especially in the male patients what we see phimosis है, prostate related कुछ issues है. Digital rectal examination हम करते हैं, bladder full है नहीं है. Sonographic evaluation में what is the post-void residue, bladder की capacity कितनी है, pre-void and post-void, whether any stones, bladder stones या फिर stones है या नहीं है, मतलब bladder stone है या नहीं है, what is the condition of the kidneys, bilateral kidneys में कहीं पे swelling है या नहीं है. Then specialist will evaluate the cause for your urinary problems. If you urinary infection है या नहीं है, they will do the urine routine examination. So the specialist will evaluate the cause for the same. If अगर कोई specified cause नहीं मिलता है, जैसे मैंने बताया, urinary infection, urinary stone, prostate related issues, bladder की capacity, the capacity may get lowered because of other causes, any other any mass lesion और कोई गठान है कि या नहीं है. So the specialist will evaluate. If everything is ruled out, then he will start therapy for overactive bladder. Overactive bladder से जैसे मैंने बताया, they will start with the lifestyle modification, they will start with the medical management, and then we evaluate the patient. As I said, the symptoms are waxing and waning. It may happen that you are completely fine for 1 or 2 years. It may happen that again you get symptoms for overactive bladder again. It may happen that you may be again fine for 1 to 2 years. So the symptoms are waxing and waning. So depending upon the severity of the symptoms, depending upon the patient need, whether the symptoms kitne bothersome hai, then we evaluate and then take the decision for the treatment.
So thank you so much, doctor. Thank you for being here with us. Thank you for your time. We had a lot of conversation, a very insightful conversation, must I say.
Thank you.
And I'm sure the listeners and our audience had a great time. So thank you once again for being here.